Breast thermography, the infrared mammogram. Breast thermography, or digital infrared thermal imaging, is radiation-free, it's non-invasive, so there's no compression to the breast, it's FDA approved, it's inexpensive, and it'll only take about 15 minutes of your time. Thermography detects early, potentially reversible physiological changes in tissue associated with the later development of breast cancer. It's earlier detection of breast disease than self-exam, exam by a doctor, mammogram, or ultrasound alone. Dense breast tissue is not a problem. Most implants, above or below the muscle, are not a problem. Again, it's no radiation, non-invasive, and harmless. Nothing touches the breasts and there's no compression. It can be used as often as indicated to trace a problem, observe the progress of treatment, or to monitor the health of the breast tissue over time. Thermography can provide a clinical marker to the doctor that a specific area of the breast needs particularly close examination. In 7 out of 10 women, thermography will be the first alarm that something is happening with the breast tissue. A thermographic image represents the highest known risk factor for the existence of or future development of breast cancer. It's 10 times more significant than a family history risk, and due to the nature of thermography and thermal imaging, cancers as deep as the chest wall can be detected. Again, it's the earliest breast cancer detection known. It can detect pathological state of breast tissue 5 to 10 years before a cancerous tumor is found by any other detection device. It has the ability to detect fast-growing aggressive tumors. It can even detect inflammatory breast cancer, which is not detectable by mammography. Here are some examples of some scans. Upper right is a normal scan. It's very symmetrical in its color pattern. In the center is fibrocystic disease. It's very red and blotchy, has a honeycomb type pattern. Lower left is ductal carcinoma, and lower right is an example of inflammatory breast cancer. Let's not forget that 1% of breast cancers are found in males. Now, let's look at some other applications for thermography, because it's not only used to detect breast cancer. Here's an example of how coronary artery disease would show up. Inflammation over the right kidney, possibly indicating adrenal infection. Here's an example of diverticulitis. It can identify pain patterns felt in chronic fatigue and fibromyalgia, as seen here in the red, orange, and white areas of the scans. There's a cold spot at the base of the neck over the T1, T2 area that correlates with immune dysfunction. Here is an example of occlusion of the carotid artery, seen in the red and white line. It can also detect other vascular problems such as deep vein thrombosis. Thermography offers a wide variety of valuable screening options depending on your needs. Call us for more information. We would be happy to answer all of your questions. Our screening services are mobile and convenient. All thermography studies are performed by highly trained and certified female doctors. All studies are then interpreted by medical doctors specifically trained in thermography. Mobile services are provided by Health Concepts 1. Our number is 770-719-8785. Please call us. We'll answer any questions that you have. If we're not available, please leave your message and a phone number and a name, and we will get back to you as soon as possible. We are now providing services at Wellbeing's Pain Relief and Peak Performance Center at 4296 Memorial Drive, Suite B in Decatur, Georgia. The phone number is 404-292-2492. Website is andyforwellness.com. Please call Dr. Andy as soon as possible and book your appointment.